Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
G'day and Swadee Kub. Well, today we got to the foot of the matter because we were very fortunate to have Dr. Tanarat from Bangkok Pattaya Hospital here giving a talk on foot problems and pain and how to overcome them. And he is an orthopedic surgeon and he specialises in minimally invasive foot and ankle surgery.
Yes.
And it was a wonderful talk and everybody, there were so many questions. Do you have any tips for people for how they can avoid getting foot problems in the first place?
So I think you should know that foot and ankle is important organ. So if you use it too much, you will feel pain from many strain or stress fractures, too much like a marathon running or something like that. So you should use the best shoe that you can find.
Also, I heard this guy who used to be a marathon runner. He said, running a marathon is like climbing Mount Everest. You just do it once in your life because really it's no good for your body.
In some doctor, they think about it's okay to do it. But in my view of the foot and ankle specialist, I think it's too much.
This is too much. You've got to look after your feet. My mother had a very bad fascitis. And she actually used to walk with a cane to take the weight off her feet. But you were saying there's things that can be done, minimally invasive things that can be done for that.
About the plantar fasciitis, if you have the calcaneal spur, a bone spur, and you feel pain at that, you try to do the conservative treatment, but it's not healed. The pain is more and more, and you cannot walk. I think we have some surgery to do it in the minimal invasive.
So I spoke to a chiropractor and he was saying, back health starts at the feet. You've got to get your feet right. So he pushed me to go and get orthotics. So this is something that a lot of people, it's worth them looking at, right? So I buy Rockports, right? Rockports, wonderful shoes, that don't have any built-in arch supports. So orthotic, they're the perfect sort of shoe for orthotics because you can just put any orthotics in them.
The orthotic, we have the over-the-counter orthotics or the custom-made orthotics that you can find anything in the hospital. We have all.
Yeah, so it's really worth thinking about. You have any foot problems, get in early by addressing orthotics, yes?
Yes.
Yeah, and of course you're just moving them from one shoe to the other. Also, of course, women notoriously have shoes that aren't good for their feet, high heels, etc.
High heel is not recommend, surely. High heel is not recommend because the load, after you put the high heel shoe, it's a forefoot loading, so you will feel pain at the forefoot and midfoot.
Even though they do look pretty sexy, right? The question came up about what is the difference between a sprain and a strain. I thought this was an interesting clarification.
Yes, the strain we call in the muscle, and the sprain is for the tendon. So we have the ankle sprain and the muscle strain.
Yeah, so there you go. It's a strain if it's a muscle and a sprain if it's in tendons. And the foot's a fairly complex area, yes, and bears so much load.
Yes, because the foot have many joints, many bone and many ligament. And to do the surgery at the foot and ankle, I think it's very difficult because you should sure that you have the construct that's secure for the weight bearing.
And one of feet's very important. A lot of people develop problems as they get older. So it's like they have a use-by date, right? And one of the things you really recommended was stretching, and one particular stretch in particular.
Because the stretching exercise to the gastrocnemius muscle and Achilles tendon is at the core problem of any foot and ankle problem. So if you do the stretching exercise with the wall set, and put the leg straight at the back side to stretching the gastrocnemius muscle, I think your foot and ankle problem will improve.
So there you go. Just that simple, where you lean against the wall and you stretch like that,
Yes.
which I do every day. That's a really good way of preventing a lot of different ankle injury problems and stuff. Well, I want to thank you for a really enlightening look at this very important problem. Just because they're down the other side, take care of your feet, right?
Take
And you
care.
got any one last message?
Oh, take care of your feet too.
You don't have any foot jokes for us, do you?
Foot check.
Foot jokes, a joke about feet.
Excuse me?
Never mind. I just put my foot in it at the end, right? So don't put your foot in it when you're interviewing a foot doctor. Anyway, it's goodbye and sweaty cub from Renlik Sand at Pattaya City Expat Club, and thanking the good doctor for his wonderful talk. You really should check it out.
You're welcome.